As you see in this photograph, you see a patient with the history of filler injection in her lower lip. But the problem with this lower lip is that there is three clinical patterns on the skin that I should consider. The first pattern is a bruising on her lower lip that I can show it to you here. This bruising is highlighted with the room light, and I can show it with some problem because this is just the reflection of the room light on her bruising area on her lower lip. This is the bruising area. This is the first clinical pattern. The second clinical pattern that I need to talk about it is a white or pale pattern. This is this part of the lip, referring to the alignment of the lower lip artery, as we talked about it in our video before. Lower lip artery is in this pathway, and the most possible event is the obstruction of this part of the lower lip artery. But the third pattern I need to show it to you is the mottling pattern. Under this pale area, this mottling pattern is the pink and white, pink and white, white, pink, just like clouds in the sky. We have mottling pattern. Mottling pattern shows the deficiency of oxygenation of the tissue because of the obstruction of the arteries carrying oxygen, and this mottling pattern is possibly because of the obstruction of the branch of lower lip artery and its connection to the ascending mental artery. Because of the deficiency of the blood circulation from the ascending artery to upward, this mottling pattern has occurred. I talked about the different steps of the necrosis after the occlusion of the arteries in my previous videos. The first pattern after any occlusion is immediately a pale area, then mottling, and then the necrosis process and ischemia will continue that may end to tissue damage. In this patient, we have seen all these three patterns. When we examine the clinical symptoms, we will hear that the patient is complaining of huge pain in her lower lip and mental area, showing the necrosis process that should be removed as soon as possible by injecting hyaluronidase or by prescribing hyperbaric oxygen and other procedures that I talked about them in my other videos in this channel. This is another patient. You also see a bruising area here on her lower lip. Then this is the bruising area, and also you may see the bruising area has been continued from her lower lip toward her tip of her chin through the ascending mental artery. This bruising is seen from here to here and expanded here. In other words, the ascending artery has been endangered because of the blockage of the inferior labial artery, and when the blood stops here, this slow movement of the blood will expand and the blood will exit from the lumen of the artery, and this will produce a pre-ischemic area. This is a pre-ischemic area. In other words, a bruise is expanding around the obstructed ascending and lower lip artery. If we do not pay attention to this clinical sign, and if we do not remove this obstruction here, we may see the mottling pattern, and then the infection process will start because of the low oxygenation and low tissue health process. In other words, the lower lip and the area around the ascending artery in the mental area may be necrosed, and pattern of necrosis may be accompanied with coldness of the tissue and loss of the sensation. These clinical signs should alert any clinician to do the treatment as soon as possible. So, when we inject filler in the lower lip and we see these patterns, we should think about the anatomical obstruction, and we should do the right choice. If there is only hematoma will be managed through massaging or not. We should not massage the hematoma. This is a very, very big mistake that most clinicians do when they see a hematoma after the rupture of any artery. After watching hematoma, you should make a cold compress on it for the first 24 hours, and for the other days you should have warm compress for reabsorbing the blood remained in the site. But if you massage the area, the hematoma will be expanded and the injury to the vessel maybe get bigger and bigger, and this may result in complete rupture of the vessel under the skin. We should not massage any hematoma. If needed, we should wait and see. Some hematoma will be reabsorbed and some of them should be evacuated. The other possible accident after filler injection in the lower lip may be because of the occlusion of the lower lip resulted from the interference of the filler particle in the lower lip lumen and stop the blood circulation that I explained it in this video before. This is very important. As you see in this case, the ascending artery was injured because of the ischemic process after lower lip artery occlusion, but through a right treatment procedure, this ascending part of the skin in the mental area was healing, and this is very important. So we should be very, very careful when we see any problem after injection. My main aim in this video was to show you the relation between anatomy and pathophysiology of skin damage after injection filler or after the rupture of the vessel wall and hematoma. Thank you very much. I invite you to see my other cases in this channel.